A concerning development in Queensland this morning with coronavirus. A nurse at an aged care facility has tested positive and authorities say she was working while sick. She was working at the North Rockhampton nursing home. It has 115 residents and 180 staff. It's another reminder of the danger that still exists while there are more staged rollbacks of coronavirus restrictions across the country today. More than 300,000 people around the world have now died from COVID-19, nearly a third of those in the US. And experts are watching closely what happens in the southern hemisphere winter now to see how the virus interacts with the regular flu season, with ongoing concern about a possible second wave of infections. So here are today's key developments in our coronavirus coverage. Victoria has recorded another 21 new infections of the virus overnight, bringing the state's total to 1,543. And as I mentioned, at an aged care home in central Queensland, it's been locked down after a nurse tested positive for COVID-19. We'll have more on that in a moment with our reporter in Queensland. People in New South Wales can now dine out within limits, swim laps and host a small dinner party as the rules are eased. Measures in the Northern Territory are also stepping back, with pubs, restaurants and gyms able to open their doors from midday. Globally, the number of deaths from COVID-19 has now passed through 300,000. The United States continues to have the world's biggest outbreak, with over 1.4 million cases and 85,000 deaths. And the wait is nearly over for footy fans, with the NRL set to detail the first two rounds of its season return. The AFL will also make an announcement today on its training and match schedule. So let's take a look at some of those elements in detail now. An aged care facility in central Queensland has been locked down after a nurse tested positive for coronavirus. Reporter Rachel McGee joins us now from Rockhampton. Rachel, good morning. So this is really concerning, huh?
Yes, that's right. The North Rockhampton Nursing Centre here is in lockdown as we know, a nurse tested positive to coronavirus overnight. Now, this nurse worked at the centre. It's around 150 bed facility, and it's understood there are around 200 staff who work here as well. So this person is in quarantine at their own home with mild symptoms, but yes, very concerning, seeing as the nurse was working at the centre while infected with this disease. There are concerns that this person was infected and contagious since the 3rd of May.
Yeah, geez. And so we just had that media conference from the Queensland Health Authorities in the last hour or so. And in that media conference, the Chief Health Officer, Jeanette Young, described this as a case out of nowhere. Are there any indications of how this nurse got the virus?
Yes, it's still unclear how this nurse got the virus, but authorities believe it may have been a trip to Brisbane. It's unclear why this nurse was in Brisbane, but in terms of Rockhampton and central Queensland, there have been no active cases across all of central Queensland for about 2 weeks now. And the last active case of that was, diagnosed here in Rockhampton was on the 30th of March. So as the Chief Health Officer was saying, it's a clear indicator and a warning towards how this can spread even when you think it's out of your community.
Yeah. And so Rachel, this story's only just popped up in the last hour or so. So you're actually at the front of this nursing home there, are you?
Yes, I'm just in front of the centre here.
Yeah.
It's there's been people coming in and out, I guess,
Right.
Still figuring out when that rapid response team will come in.
Yeah, because in that media conference we heard Stephen Miles and the Chief Health Officer talking about this rapid response team, but it's not. Is it clear if they've actually arrived there yet or not?
I'm unsure whether
Yeah.
they have arrived. I understand they've been sent from Brisbane to come here and do that rapid testing to test everyone who's here and has been here in that time since the 3rd of May.
And Rachel, just while you've been standing there in the last 40 minutes or so, have you noticed any relatives try to come up and enter the facility, or anyone milling around or not?
There's been some people milling around and driving in and out, but I'm unsure as to whether that's busier or quieter compared to a normal day here. So there was a man who walked past before and asked us for some detail about what's happening. So that message is still getting out.
Yeah. Okay, Rachel McGee reporting there from Rockhampton in central Queensland. So deeply concerning news there, considering what's happened in some other nursing homes around the country in relation to this virus. So authorities really keen to get on top of that as quickly as possible. But we'll be right across that story through the day here on the ABC News channel. Victoria has recorded another 21 cases of coronavirus overnight, bringing the state's total to 1,543. One has been reclassified, so there's a net increase of 20 rather than 21. 2 cases are linked to an outbreak at that Faulkner McDonald's. I think we'd had about 6 to 8 who were previously connected to that. One infection is linked to the Cedar Meats outbreak, so that I think there's about 90 people connected with that outbreak at the moment. So that news only just coming through from Victoria with some a statement on that in the last hour or so. We haven't had a media conference with Victorian health officials or the Victorian Premier yet, and so that's a decent jump comparatively in the number of cases there in Victoria. So we'll bring you that media conference with Victorian officials just as soon as that happens. Now, there are more staged rollbacks of coronavirus restrictions across the country today, but authorities are warning the number of new cases will likely increase and are urging people to remain vigilant. People in New South Wales can now dine out within limits, swim laps and host a small dinner party as rules are eased. Reporter Jessie Dorset has more from Sydney.
I'm in the playground at Sydney Park. There's plenty of people out. Even though it's just about to start raining, a lot of people are here and making use of the easing of restrictions. Yesterday we saw council workers in this very spot disinfecting all of the play equipment. So people like Rachel and 4-year-old Abby can enjoy them. G'day Rachel, enjoying the swing there?
Oh, loving it. It's really good to be out and a relief. So, having lots of fun this morning.
What's it been like being at home for so long with a 4-year-old?
It's been trying. Lots of art, craft, television and iPad. Because my husband and I have been working as well. But it's just good to be out and do the things that we normally do. So. Yeah,
absolutely. There's so many families down here, but from what we've seen, everyone seems to be keeping their distance and doing the right thing.
Yeah, so far it's been fine, and we haven't had any difficulties with kids coming close. And we were on a bit of equipment before, and some other kids wanted to come on, and we were like, "Oh, just let us finish." And so I think everyone's aware that they need to, the kids are aware that they need to social distance, and so it's been fine.
Yeah, absolutely. Abby, are you enjoying the swing?
Yeah.
A bit shy, but certainly the star of ABC News Channel this morning. Oh, there's plenty of distance. It's just perception.
Okay, so Jessie, what else is open in Sydney today?
We've seen a lot of cafes this morning, Joe. They're allowed up to 10 diners, restaurants too, and a late development this week, pubs and clubs are allowed to operate under the same conditions. They're allowed up to 10 diners if they can socially distance those people. Funerals are allowed 20 mourners inside, 30 outside. The industry says that should ease some of the pain of grieving families. Weddings, up to 10 guests can celebrate with the couple and the bride and groom and or whoever the couple is, and also the celebrant. And we know that church services are also beginning in Sydney and across New South Wales. There can be up to 10 worshippers inside a church, and that's what we saw at St Mary's this morning.
Jessie Dorset reporting there. Restaurants, cafes, gyms and beauty salons across the Northern Territory are getting ready to welcome customers for the first time since March. Kate Ashton reports from Darwin.
It all kicks off at midday here in the Territory. Pubs, cafes, restaurants will be able to open their doors to customers, but they will have some restrictions. So they'll be looking to have people only who are seated, so you can only get a beer if you're seated and you're having a meal. Nevertheless, lots of people have been looking forward to this moment. We went out and about yesterday, spoke to some business owners and punters. Here's what they said.
We're really keen to stick to the regulations. We really want to do this right and make sure that if there is any national or international coverage of this, that Darwin looks like they're doing it really, really well and we're leading the way.
It's looking forward to. I've already got the booking over at around the corner here, one of the establishments, and looking forward to getting back to semi-normality.
I think, speaking for a lot of the musos, we all lost everything. it was just like someone turned off the switch, but actually just this week someone has turned the switch back on, and so totally excited to hit the stage tomorrow.
Oh, that's so cool to hear the musos getting back in amongst it, because, people involved in the arts have been really badly hit by this because a lot of them haven't been able to get access to that JobKeeper payment. So, Kate, how is this going to be overseen by authorities there in the Northern Territory?
Look, it's a good question. The way that the Northern Territory government has been putting it is they're not that interested in compliance and dishing out lots of fines like we've seen in other jurisdictions over the course of the pandemic. So it's really going to be up to the individual business owners and people who are visiting them to make sure they're keeping that 1.5 metre distance from each other and staying within their own group. So if you're sitting at a pub having a meal, you need to stay within your own social group and not wander around and potentially, get in contact with other people as well. Police said yesterday that they were hoping people wouldn't be clowns this weekend, so that's some solid advice from the Northern Territory Police Commissioner, and they will be out and about, but I think encouraging people to abide by the rules and remembering that it's not just about, Territorians who are getting to go out and have a meal or have a beer, but we're expecting over 2,000 hospitality workers will be back in a job this weekend, which is just huge for the local economy and for everyone who's been spending this time without work.
Kate Ashton reporting there from the Northern Territory. The National Cabinet is meeting right now to discuss how to tackle mental health problems caused by the coronavirus crisis. State and Territory leaders will also compare notes on how they're gradually easing restrictions 1 week after the Prime Minister announced the Commonwealth's roadmap for opening up. Political reporter Stephen Jedgetts has more from Parliament House.
Experts are now doing some modelling, trying to work out exactly how this is really ricocheting through the community. And of course, it's unsurprising that this would have a devastating impact on mental health when you think about the sheer scale of the disruption that we've seen. We've not only got people feeling much more isolated as a result of the restrictions that have been put in place, but also, of course, the enormous economic shock that coronavirus has brought, with hundreds and thousands of businesses being shuttered and livelihoods being placed on the line. So mental health experts are warning that this is going to have a terrible impact across the nation. The Victorian government is expected to put some modelling to National Cabinet today, which shows really just how deep this could run. They estimate that there could be more than 300,000 people over the next 3 years or so who will require assistance of some description because of the coronavirus impact. And they're really pushing for a really substantial investment in mental health to deal with this problem. They'd like to see more money put towards mental health hubs, more money put towards at-home care services and the like. Now, it's really New South Wales and Victoria who have been pushing hardest on this. Today, the National Mental Health Commission will present to National Cabinet the plan that the federal government has asked them to put together. You can imagine that all the states will be keen to reach a consensus on this, and it will be interesting to see exactly where they land later today.
Yeah. And Stephen, yesterday the Australian Bureau of Statistics came out with its April unemployment figure. A huge number of people joining the jobless queues in Australia, and no doubt that's going to weigh heavy on the minds of leaders there in this National Cabinet meeting today.
That's right, Joe. Some really wicked conundrums facing the leaders at the moment. Of course, everyone knows about those terrible employment figures. Not as awful as some people feared, but devastating nonetheless. Some 600,000 people out of work who were working a few weeks ago. Now, the Morrison government has been adamant that the way to deal with this is to reopen the economy. And of course, we have now, as you've been hearing from across the nation, seen all states gradually begin that process of easing restrictions. But it's a difficult balancing act. Today, National Cabinet is going to get briefed by the Secretary-Treasury and also the Governor of the Reserve Bank about the scale of the economic shock that we're all facing. And, of course, the risk here is that if we do open restrictions too early and ease up too quickly, then that we might see a resurgence of the virus. And if that happens, then leaders will face an almost impossible choice. Do they, continue to open up and just do their best to contain that wave, or do they contemplate once again trying to shut down parts of the economy and reintroducing restrictions? That would represent a massive psychological blow, really across the nation. They'll hope desperately that they won't be forced to do that. So you can imagine, as you say, that will weigh heavily on leaders today.
The number of coronavirus cases in Brazil has passed 200,000 after a record 14,000 infections were identified just in a day. Nearly 14,000 people have died, the highest death toll in Latin America. Brazil's governors have imposed ever stricter restrictions to slow the spread of the disease against the will of the President Jair Bolsonaro, who says job losses are more damaging than COVID-19. A top US virus expert who was ousted from his government role has told a congressional hearing the country faces its darkest winter in modern history. North America correspondent Catherine Diss has more from Washington.
Dr. Rick Bright was the former head of America's chief federal vaccine agency. He was ousted from that position about 3 weeks ago, and as a result he wrote a whistleblower complaint which detailed the reasons for why he thought that he had been sidelined from that position. Among the reasons, he said his criticism of the White House response to the coronavirus pandemic is one of them, but also his efforts to stop the White House and also the President from pushing the use of drugs unproven to treat COVID-19 to make them widely available. So as a result of that complaint, he was then called to give testimony before a US House committee, which is what he has done over a period of about 4 hours today, where he has detailed how he tried to repeatedly raise the alarm as early as late January, but his concerns were repeatedly cast aside. He also pushed for the ramp up of production of medical supplies, but he said those urges also went unheeded for a number of months. And as a result of all these actions, he said that lives had been needlessly lost. And he also painted a fairly stark warning for the months ahead, in which he said that America could be in for its worst winter in modern history, predicting what he thought would be a second wave of the infection come fall. Let's take a listen.
There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history. First and foremost, we need to be truthful with the American people. Americans deserve the truth. The truth must be based on science. We have the world's greatest scientists. Let us lead. Let us speak without fear of retribution.
And of course, the US President Donald Trump has also weighed into this. He first took his claims to discredit what Mr. Bright has been saying on Twitter, but he also spoke before boarding a plane to Pennsylvania today, where he again reiterated that he was a disgruntled, unhappy employee who didn't do a very good job and wasn't respected. He also picked holes in some of the comments that Dr. Rick Bright made about the vaccine and it potentially being available within 12 to 18 months. Dr. Bright said that that was highly optimistic, whereas the President today has again said that he believes there will be a vaccine by the end of the year. I don't think it's surprising that the President has chosen to use these types of words or attempt to discredit his testimony or character, given that we are just a few months away from that November poll.
Catherine Diss there. The World Health Organization says European countries need to prepare their health systems in case COVID-19 becomes endemic. Europe has reported at least 1.78 million confirmed cases and more than 160,000 deaths. The WHO is warning that the virus could become seasonal.
The lesson here is no time for celebration, but time for preparation. Because it's not the first time that the world is facing a pandemic, but definitely this has been a very, very devastating one. So even if we have few cases, we have seen that the strongest health systems can be overwhelmed in a couple of weeks. So the preparedness of the health system capacity and the public health capacity like surveillance is crucial here. That's the key issue. We have to realize that we are living in a planet full of viruses. So as of today, no one knows, but the option is there. The virus may also become what we call endemic, like a number of seasonal viruses from the corona group is one option. Other option is it can't mutate, but The key issue is that it's an interplay between the virus, how it behaves, how the people, the human population is behaving, and very important, the intervention.
Residents in Madrid have taken to the streets for a fifth night to protest the government's handling of the coronavirus outbreak and lockdown. Banging saucepans and blowing whistles, protesters demanded the resignation of Prime Minister Pedro Sanchez, blaming his government for poor preparation and damaging the economy. Madrid has been Spain's worst hit region, with more than 8,750 registered deaths. And a reminder that you can keep up to date on all the stories we're covering at news.abc.net.au and on iView.